Friends, we must know what is stricture urethra. Stricture is a narrowing, and urethra is a urinary tube through which urine comes out of the body. So when the bladder contracts and pushes urine out, the urine comes out through the prostate and then through the organ, which is the urethra. In males, it's a longer organ of 18 to 20 centimeters compared to women who have a short urethra of 3 to 4 centimeters. Stricture can happen in young, middle-aged, elderly, can happen in men and women. Stricture is a narrowing of the urinary pipe, which your doctor tells you, and you understand it best when you see that post-trauma, post-injury, post-surgery, post an accident, the urinary passage is narrowed down, the flow is poor, the flow is almost absent. Many patients actually land up with a urinary passage which is coming out of the bladder called the suprapubic cystostomy, especially post-trauma. So friends, stricture urethra sadly is ubiquitous. It is seen all over the world. Stricture urethra has got treatments available and cure available. Are we looking at treating and being in the journey of continued treatment where the results are only suboptimal, or we're looking forward to getting it sorted out completely? So friends, stricture urethra is a treatable and a curable phenomenon. Segments of urethra can be actually going through a healing process because of a catheter, because of a trauma, because of a surgery. Don't forget that urethra is not a composite, straightforward, uniform tube. There are areas which are narrow, like the fossa navicularis, the meatus, the bulbar urethra, which has got a great blood supply but a narrow urethra. Going up the membranous urethra, it is a narrow one. The prostatic urethra is something where the prostate occludes the urinary passage. So, in men, all these various components of urethra can undergo changes, and these changes are something which we need to be awake to. So, friends, stricture urethra is treatable and curable. For shorter segment mucosal strictures, sometimes we calibrate, we dilate, we put patients on self-calibration, and they stabilize completely. But friends, there are two kinds of repair techniques or curative techniques one needs to know. One of them is called a urethroplasty, of the kind where we anastomose and repair a stricture which is completely occlusive or blocked. Many of these patients are passing only in drops. Many of these patients had road traffic accidents, traumas, injuries, domestic or otherwise in the road. Many of them have actually got a suprapubic cystostomy or a catheter in the tummy through which the catheter is changed month after month, year after year. So these are all those road traffic accident blockages, complete blockages where a fibrosis has happened and the segment needs to be cleared. More so the bulbar and the membranous urethral regions. But when we look at the anterior urethra, the penile urethra and the bulbar urethra, longer segments of stricture, which happens because of inflammatory phenomena, traumas, catheters, and traumatic injuries which could happen around post-operatively and iatrogenically. These are repaired by substitution urethroplasty or buccal mucosal graft urethroplasty. Friends, awareness is a key and requirement. Knowing that will take you forward into a curative therapy for stricture urethra.